Did you know that Kenyans are ranked number 2 among African immigrants as far as HIV and AIDS is concerned? I'm talking to Tina Abdul Aziz from Center for Multicultural Health here in Seattle, and today we are talking about HIV and AIDS program and other programs that they offer. We want Tina to tell us more about HIV and AIDS and what can we do to make sure that these numbers go down. How are you, Tina?
I'm okay.
Nice to have you here.
Thank you.
Now, we would like you to introduce yourself and to tell us a brief introduction about your life, where you grew up, and why did you end up in health industry.
Okay. Yes. I grew up in Tanzania, was born in Tanzania, and I came to US 1997. And I'm a health educator at this non-profit. Center for Multicultural Health is funded by Public Health. And the main program that we do here, where I'm affiliated with, is called HIV Program for African Born. Or sometimes they call it African Immigrants.
Okay.
Because we do have African Americans who are also black.
Yes.
And they kind of categorize us it's different because we come from different cultural backgrounds, and when it comes to prevention on HIV/AIDS, as far as languages, culture, methods of treatment, this is a different group.
Okay.
So why we are concerned with Kenyans, because the numbers have been going up in the last 10, maybe 15 years, and the main thing that we want to do is to raise awareness that if you've been here long, or if you were born here but you're of an African origin, it's good to get tested. And I know that sometimes there are a lot of questions why you're focusing on Kenya, and what we want to say is we just, everybody can go into the website of Washington State Health Department, and they have all the numbers, epidemiology, HIV facts among African born, and the we have a lot of Kenyans here, and we know they all come from different backgrounds. And we would like everybody to get involved and share this information so that we put the numbers down. And I have my colleague that is from Ethiopia. He speaks Ethiopian, Amharic and Tigrinya. And we kind of all collaborate because we have similarities in what we do. So, and what we usually do is we arrange health fairs. Sometimes we go for outreach to different places, and we talk to different groups about how we can go about doing the work. Now,
the rate at which the HIV prevalence among Kenyans has shot up. What are preventive measures that you're talking or that you're telling Kenyans to use ndio at least hizo number zipungue?
So I think watu wa nyumbani wanajua kwamba protection it's very important. Kwamba just because tumekuja Marekani kwamba tumesahau kuhusu HIV. Kwa hiyo lazima protection, watu lazima watumie condoms. Number 1. Number 2, kama watu hawataki kutumia condom because maybe they feel like they're married, they don't have to, lazima wajipime. Now, kujipima, how do you get tested? You tell your doctor to get tested when you do your yearly checkup. If you don't have a doctor, our center here, we do testing every day. You can call us, make an appointment. It's free. And there are so many other places that you can go to do HIV testing.
Do you have like a network that or support group that kama mimi nikikuja and then I test positive, do I have people who will sit down with me and tell me, okay, this is not a death sentence. Kuna hizi unaweza kunywa madawa, unaweza fanya ABCD, watu wa kucancel ndio mtu asisikie kama ataenda kujinyonga ama maisha yake imekuja, you know, imefika mwisho.
Yeah, so what we're trying to say is HIV has come a long way, and it's like it's a disease that anybody can manage. the most important thing is once you get tested positive, we refer you to a program that you will see a doctor, and the doctor will let you know what to do. You're not going to die just because you have HIV.
Yes.
You might die if you're not going to take care of it. Because then you might get sick and then you go to the hospital, it's going to be the last minute, and they will say, oh, maybe you've had HIV for a long time, but you did not take care of it.
Yes.
But if you see a doctor, and there's so many doctors here in King County or the whole of Washington that are taking care of people with HIV. And our program here, if somebody tests HIV positive, we take them to Harborview. There's a program there that is called 1-on-1. And the doctor there will let you know when to start medication. And nowadays, they start medication early. They've realized that it's better to start medication early. And even if people have other issues, because sometimes people have so many issues apart from HIV. Yes. We know that people don't get tested because they don't have the means. Or when they get tested, they said, oh, I cannot leave my job. What am I going to do now? Yes. So there are so many programs that will help you. What we've realized is most people don't know what kind of programs are out there. Okay. So that's why we talk of support groups. We talk about some people, they don't have housing. What if somebody has a lot of kids getting tested HIV positive, doesn't want to tell their family due to stigma and fear? What can they do? So there are people who can guide you in how to go about it.
I think the major thing about HIV, venye imepanda hivyo ni stigma, and I want to ask you, why do you think that Kenyans the percentage imeenda hivyo juu? Is it that because hatutumii condoms na tunajua? Is it that because we don't get tested? Is it that there's a lot of information but we are ignorant? We don't want to, you know.
I think there's a lot of things why people, HIV might not be a priority in a lot of people's lives because they figure, you know, they're in America, everything is okay. Yes. And people are busy working. So people wants to take care of their family back home. People are working 2-3 jobs. Yes. Some people, you know, they come from one job to another job. Yes. They really don't have time to say my health is important also. Yes. In order to take care of those people, I have to be healthy. Yes. So if you're not healthy and you're going to get sick one day, you're not going to be able to take care of all those family members back home or here. Yes.
Now, where do you give out information? Do you go to churches? Do you go to community groups? Because I believe so many Kenyans, I don't think they know about the Center for Multicultural Health. And maybe because I don't think we have had information enough, or ni ile tu kuogopa unasema oh nikienda huko maybe nita test positive, and because I've seen so and so, the stigma again. Which groups do you relate with when you're giving out information?
So we've worked with the Kenyan Community International Church for a while. They've been very positive in their outlook about health in general, not only HIV. Yes. And we have found that if we have all these health fairs, that people are doing everything at once, it helps to reduce the stigma. Yes. Because then we're not only focusing on HIV, we're focusing on everything else. Because you know our communities, it's not only HIV, some people have diabetes, some people have TB, some people have blood pressure, some people have cholesterol issues, and there's hepatitis B, hepatitis C, and what we recommend people, even if they don't want to come to this organization or non-profit, they should still go to their doctors and tell their doctors that.
And Tina, sorry to cut you, because I know so many Kenyans don't have doctors, and wengi hata hawana insurance. So that is a major problem that we have, that nitakuwa mgonjwa lakini nitaenda hospitali gani? Ile hospitali nitaenda, maybe it's asking for way too much and I cannot afford it. Do you have any other, because I know a clinic in Tacoma, I don't know whether you guys work together, it's a free clinic, whether you can get in and get tested. Do you use other hospitals or other places that unaweza nituma hata kama sina daktari wangu, I can go there and get tested?
Yeah, so what I always recommend to anybody that I meet is, if you think you're going to stay in America for a long time,
yes,
5 years, 6 years, 7 years, it's good to look for a doctor.
yes,
A primary doctor is very important. Now, you might ask why, because people get charged.
yes,
I would say I'm an African. If we're here and we're going to stay here for a long time, if there's a neighborhood community center at your area,
yeah,
go visit and set yourself up and say, this is going to be my primary area that I'm going to go and visit a doctor. Now, they might charge you a sliding fee. Pay them a sliding fee. It's better to pay that sliding fee than go to the emergency room and get a huge
and health is the most important thing that we all need.
Yeah.
You know, and I'm so glad that you're here, because without health, without good health, you cannot even work. So I'm so grateful that you're here to tell us where we can even get free services.
Yeah.
You know, to get tested. So Kenyans, I don't think Said took on any what do you call it? Any excuse for us not to get tested.
Yeah.
You know, you can come in here, or you can go to any other clinic closer to you and get tested. Tina, I have a question, because this applies to so many people. Mtu mwenye hana makaratasi, undocumented, and they really need to come out and get tested or get, you know, the free medical attention that you're giving. So how do you go about that? Are they included? Ama wanachujwa wanawekwa kando juu hawana makaratasi?
No, actually, once you test HIV positive and you get we refer you to a doctor. They don't discriminate you because you don't have papers, or you're here undocumented, or you're here illegal, whatever terms people use it.
Yes,
it's they do all the intervention that are required, regardless of your
status.
Okay. That's not an issue, and people should not fear.
Okay. I hope watu wamesikiza mtu asiogope, because you know I know there are so many people who will be like, oh, nikienda huko wataniitania, ama you know.
Yeah, kwa watu wasiwe na wasiwasi. Kwa public health point of view, wao wanataka mtu akiwa positive asikae akangoja tu mpaka kaumwa.
Yeah.
Ukiwa positive, look for me or Solomon. There's another guy here who's called Solomon. Sisi tutakupeleka pale unapohitaji kupata kila kitu cha kushughulikiwa na daktari. Now, mambo yako makaratasi, that's a separate issue, because it's an immigration issue.
Okay. So you don't touch that. You're not.
And hata madaktari hawato touch that. The aim will be to treat you so that you're healthy, you work, you take care of your family, and that's the reason you came to America, to have your American dream fulfilled. Huh?
I've seen you go around churches. When you go to our churches, and when I'm saying that, I'm a Kenyan, so I'm talking to the Kenyan churches. What response do you get? Do you get pastors who embrace the information that you're giving out, or wanasema, you know what, we've had that maybe for a while, ama it's not part of us? What interaction yako na mapastors wetu ama community leaders imekuwa aje?
I think I would say nawashukuru sana huo wananisikiliza, lakini I would say that also wanahitaji kufanya kazi zaidi. Na ninavozungumzia kwa kazi zaidi ni kwamba, unajua mimi nikienda tu nikizungumza, ile ni mazungumzo tu. The work has to be done by the people themselves. And how do you do the work is by having the prevention message to everybody, that people know how to navigate the system. So I know the pastors are there to look after the welfare of their communities. So health should also be a priority in their churches. So tukiangalia mifano katika communities nyingine hapa tunazokwenda, tunaona hata kwenye makanisa yao they have health ministry. Sasa tukiangalia katika makanisa yetu hakuna health ministry. Tuna women ministry, tuna men ministries, young ones ministry, youth, children, I think, and then there's so many ministries, but we have not included that part of health. Na kama tutakuwa hapa kwa miaka mingi, I think we should embrace that part.
It is vital,
and say that this should be part of our us too, and that way it will be easier in case mmoja wetu katika kanisa anakutwa na kitu, sote tunajua what to do.
There's this Aura Quick, and this is in-home HIV test. Tell us more about it.
Yeah, so Aura Quick, it's a test kit that has been used in a lot of places for a long time. Since for the past 1 or 2 years, they've been put it in the pharmacy. It's sold, I think, $60, $70. Now, what we have done here in our office is we are doing a pilot project for African born too. So let's say somebody wants to test at their own place, their own privacy, we give to them, and then we let them know that if you test positive, you come back to us, we will take you to a doctor, or we will give you that information to go if you have your own doctor. So you can go.
You have now, just introduced it?
Yeah, we are going to start giving it out around June. And what happens is it's a 20-minute test. You swab on your mouth. And then you put it, and it gives you 2 lines. One is, if it's 1, it's negative. If it's 2 lines, it's positive. And what we are trying to tell people is like, you can do HIV testing at your own home, at your own home. And the best way to do it is the instructions are all in this box. Right now we have like only 50 of this, and we're going to give to a lot of African-born communities. Then we would like Kenyans who would like to have it to call us, and then we will let them know, we will give it to them. And also, the test that we do in our office, it's a 1-minute test. You know, when you come to this office and we do the test, it's 1 minute. You know your result in 1 minute. This is 20 minutes, but we have one for 1 minute. So nowadays, the technology, it's really good. You come to our office, 1 minute, you know your result. If you're positive, you get into treatment. If you're negative, you go home, but you still use protection.
And is it accurate?
It's usually 98 point something accurate. And what happens is, if it's accurate, you do another test for confirmatory. And that goes to a state lab, and they will send you the result to say that was confirmed positive. If it was negative, they will tell you to do another one.
Wow, this is so good, and I believe that Kenyans will come here to the Center for Multicultural Health, and you can even get it, you know, at your nearest pharmacy. What are the programs that you have apart from HIV and AIDS? What are the programs that you give?
So we have breast and cervical health program. We have infant mortality prevention. We have refugee health advocacy project. We're also doing like tobacco prevention and other small programs that with other communities. You know, there are communities here which like citizenship, people who want to apply for citizenship, and maybe they're low income. We have case managers here who do that. And they kind of help, especially for people who don't speak the language, English. So the case manager will let you go through that and explain to you through the whole progress.
At no cost?
At no cost, because with the citizenship, usually, especially for people who don't work, it's like you can get a free, they waiver the money if you have been here for more than 20 years or something. So, and most people who are older, they don't speak the language, they need help, so the case managers are there to help them out. Go through the process, because sometimes it can be intimidating.
Thank you very much. And the HIV prevalence, before we shift gears, is we see women are more, have a large number than men. Why do you think that?
Yeah, so we know that if you look at other people that get infected with HIV in Washington State, you have the African-born, people get infected through heterosexual means. So sometimes people will say, oh, I'm married, I don't have to get tested. But we like to say that if you're married, that can be a risk factor. Let's say you came here for the last 10, 20 years, you have never tested, but you have a partner who travels back and forth, home, come back. You don't know what that partner is doing back home. Unprotected sex, you come back, you infect your partner, and then, but you're okay because you feel like, well, we're all in a monogamous relationship. But actually one is not. And there is also another factor that we tend to date people from our own communities. So yes. I will date a Tanzanian, you will date a Kenyan, because you feel more comfortable with your own African-born brother, or you know. So there's another factor that there's also concurrency. You know, yes. One person sleeps with another person, and that person sleeps with another person. They come back to their old girlfriend, and the fact that none of those people in that group get tested, it multiplies. Oh my God. And the most important issue is most people don't get tested. Yeah. So if, let's say, I'm going back to Africa tomorrow, yes. I have sex with a guy, yes. unprotected sex. I come back and I have a husband here. I have sex with a, I can infect that. Yeah. I can. So, and usually we see women, and I think some women, they come here single. Maybe they were infected back home. Yes. They didn't know, and they come here, they didn't visit a doctor. And we know that some people are infected here too, yeah. because of the same thing. Nobody's getting tested, so people don't know if they're infected or not. Do we have a number, like it's between 25 and 40, it's between 50 and over? Yeah. Is it, you know, among the youth? Do we have a number that is most... We like to say everybody should get tested. Yes. If you're 18 and over. But the numbers that is showing in the health department is over 35 onwards. Oh my God. Women who are over 35 and onwards. And that applies to men too. So I don't like to say, okay, just because the numbers are showing a lot of women, that men should not get tested. Yeah. It should be both. And we know of discordant couples. Exactly. So yeah. I think everybody should, it's a challenge to everybody. But I have a tricky question. Because let's say I'm married and then I go tested. I go get tested and then I come again, I sleep with my husband. So, and he goes, maybe like the example that you gave, he goes to Kenya and then comes back. So how often should married people get tested? I think everybody should get tested at least once a year when you go for your physical checkup. And sometimes you have to be proactive, because sometimes you go to a doctor and you tell you, oh, you don't need to get tested. Yeah. You're married. And they'll be like, you need to test me because I want to get tested. Yeah. So you as a person have to tell your doctor, it's my yearly checkup. One thing that I need to get tested is, one of them is HIV. Yeah. And if the doctor says no, you need to change that doctor and look for another doctor. Yeah, I think it's my free will, you know, to get tested and to know my status, and it doesn't cost anything. Yeah. At the end of the day, whether you test like 5 times, you know, test as many times as you want. Yeah. And for those people who are at high risk, yes, if you have multiple partners all the time, especially unprotected sex, you have to get tested every after 6 months. And for those people, we let them know that maybe oral quick home test kits is good for them, but if it's too expensive, they can come here and get tested for free. Yeah. Okay, we have our Kenyan leaders and pastors and community leaders. What would you like them to do for you to help you, you know, create awareness and let everybody know that there's free checkup, you know, there's a lot of free stuff that is going on. They can come, whether it's women health, men, and everything else, that they can come in and get tested. I would say that for all the leaders and members of every community, this is our responsibility to take care of ourselves and to take care of our sisters and our brothers. If you are in a church, if you are in any kind of group, it doesn't have to be a church alone, and you feel the need that health has to be a part of your program too. Yeah. Now, if it's too hard for people to come to our office, we are glad to go to where they are, especially if people are already organized. Yes. So if somebody says, oh, we have few young people that needs to get tested, we are ready to come in, we get organized and say we will come on this and this day, we will test. And if people are not ready to do that, then we advise them to get tested with their doctors. Okay. Thank you very much, Tina, for all the information that you've given. And this is free information. You can get it on the, is it? The Washington State Health Department.
and you can always come into Center for Multicultural Health and get all the information that you need. They have so many flyers. This is Babes Network.
The Babes Network is
Yes.
for a sisterhood of women who test positive in their lives, and they've been living with it for a long time. And it's the support group, because sometimes people don't know where to go if they test positive. And most women there are of different backgrounds.
Yes.
So some are Caucasian, some are African, some are Latinos. And what goes on in there, I won't know, because it's only for positive women.
Yes.
And for us, we usually refer them there. And we would like to, what we would like to happen is eventually to have the African-born support group,
Yes.
if that will happen. But as you know, most of the African-born women do not talk about their HIV status, because there's a lot of fear about talking about HIV, and we would like that to change.
Yeah.
So, Babes Network, it's in Seattle. And if anybody needs information, they can call us. We can let them know where to go. And they have a lot of programs there, actually. I visited in some of their health fairs, so
All right.
they're pretty good.
Thank you very much. We have to wrap up, and I mean, there's a lot to be offered to our community. And the main one being Kenyans in particular. There's application assistance with US citizenship, there's in-person assistance, there's so much that is free, I mean that is given free when you come to the Multicultural Health Center here in Seattle. I was talking to Tina Abdul Aziz, and she's a health educator, and I'm so grateful.
Thank
so
you.
grateful for sharing all that information. Thank you again.
Thank you very much.